All right, good afternoon. Thank you so much for joining us for today's electronic visit verification or EVV public meeting. Next slide, please. Just some general housekeeping. If you've attended these in the past, you'll know this by now, but all phone lines are muted for today's meeting. Questions should be submitted through the chat feature, which you should all have available to you in that right-hand menu. We will not be answering submitted questions during today's presentation, but please submit those questions again through the chat feature and we will address them after the presentation through a listserv communication or directly through outreach to you. Please reference the slide number if applicable when you submit your question. That is really helpful in us helping to address the question that you are submitting. Next question, next slide, please. So today's agenda, we have some general EVV reminders first thing, then we'll have the updates from the Office of Medical Assistance Programs or OMAP. Then we'll have some updates from the Office of Long-Term Living or OLTL. We'll have some updates from our Office of Developmental Programs or ODP. We'll then go into frequent issues and resolution steps. We'll then have an update on or updates on DHS system implementation. And then we'll end today's presentation with the frequently asked questions. I will note, from the get-go that a lot of this information is a repeat of information that we have shared in previous public meetings. But as we have stressed in past public meetings, we have found that this information is necessary to go over with the group again, because we do see time and again the same questions that are submitted either through the resource account or through the PAC line. So just some general EVV reminders. Section 12,006 of the 21st Century Cures Act requires all states to implement the use of EVV for Medicaid-funded personal care and home health care services that require an in-home visit. EVV must be implemented for personal care services, or PCS, by January 1st, 2021, and for home health care services by January 1st, 2023. I want to pause here and just make sure that you understand that EVV is a federal mandate and that it is required under the Cures Act with specified deadlines, as we've noted here on the slide. We were able to apply for and did apply for and receive approval previously for the good faith effort exemption, because as you may already know, the Cures Act originally stated that EVV for personal care services needed to be implemented by January 1st, 2020. We applied for that good faith effort exemption and were able to receive approval. So that deadline is now January 1st, 2021. So approximately a month from now, or a month and a half from now. And again, that is for personal care services. Most of the content incorporated in this slide deck is relevant to personal care services. I will mention that we are looking at home health care services and identifying what those services are. We plan to issue those services that will apply to EVV in the first quarter of 2021. So we will make sure that that is relayed out to everyone through the listserv communication and on our EVV website once we have that available for you. I also wanted to just mention again how important it is that you remember that beginning January 1st, 2021, personal care services claims will begin to deny if there is no corresponding EVV data associated with them in the DHS aggregator. So just a reminder too that, when we're talking about personal care services and whether or not your services fall under the Cures Act requirements and therefore apply to EVV, you'll see that we are sharing here the provider type and specialties, the combinations that do apply to EVV at this time. And you'll see 51 home and community habilitation, as well as the specialties of 510, 513, 363, 431, and 430 are included here. We also have provider type 55 vendor, as well as with the specialties of 554 and 555. We also have provider type 54, intermediate service organization, with the specialties of 540, 541, 362, and 512. And then finally, we have the provider type 59 for OLTL programs with specialties of 362 and 512. And just a reminder that we will be posting this to the website in case you need to refer back to this at a later point. We also have the handout PDF version of this presentation available to you. It should be attached in your menu, so you should be able to access that as well. So additionally, you're required to be enrolled in one or more of these service programs to fall under the Cures Act mandate, and those service programs are Act 150 program, OBRA waiver, Community Health Choices or CHC waiver, Consolidated waiver, Person Family Directed Support waiver, ID-based program, Adult Autism waiver, and Community Living waiver. Again, that applies to personal care services. All right, with that, I will turn it over to Ellie for OMAP updates.
Thank you. All OMAP fee-for-service providers intending to use the DHS SANdata EVV system must receive training for the DHS SANdata EVV system. Training will be done using a train-the-trainer model. The webinar was conducted on August 28, 2020. Providers may still do self-paced training if they were unable to attend the webinar. The training may be accessed at the following website link. DHS will issue login credentials to access the DHS EVV system or the EVV aggregator once a provider completes the mandatory training. MA bulletins have been prepared for OMAP providers. MA Bulletin 052002 for fee-for-service providers was issued on August 26, 2020. An MA Bulletin for the physical health MCO providers is currently under review and will be issued in the near future. Fee-for-service providers are expected to be using either the DHS EVV system or the alternate EVV system of their choosing at this time. Fee-for-service EVV administrators are required to complete and return the EVV system account verification document and return it to DHS per MA Bulletin 052003. Completed forms will continue to be accepted after September 1st, 2020. Forms will continue to be accepted beyond September 1st, 2020, so providers need to submit the form as soon as possible. The department will do a targeted outreach to providers based on their status. Currently, there are 14 agencies that have not submitted EVV data through the aggregator, and those are among the agencies the outreach is targeting. Medical Assistance Bulletin 052003, titled Electronic Visit Verification for Personal Care Services provided in the fee-for-service delivery system, may be viewed at the following link. More information can be found on the department's EVV webpage, also at the following link. Personal care service claims for physical health MCOs with a date of service on and after November 1st, 2020 will be matched to information in Promise and compared to information in the EVV aggregator. If the information does not match, error status code 927 or 928 will post and have a pay and list disposition. Encounters will still pay at this time. Beginning with dates of service on or after January 1st, 2021, the above referenced physical health MCO encounters posting error status code 927 or 928 will post and have a deny disposition. Activating new clients in DHS EVV. By default, any new client will show in the DHS EVV provider portal with status pending. As a reminder, providers must confirm their clients by updating their status from pending to active. When in Edit Client, navigate to the Program tab. Under the Client Status heading, the field status is displayed. For more details, providers using the DHS EVV solution should refer to Administrators, Client Module course in the Pennsylvania DHS Electronic Visit Verification, EVV Self-Paced Training for Agency Providers. All other staff EVV SAM data training guide on DHS EVV webpage, pages 53 through 60 of 245. And for the next presenter, Kristen.
Thank you, Ellie. Next slide, Mbote. So I will be providing a few quick updates for OLTL. And this first update, although it is under OLTL updates, this does apply to all programs. So OMAP, OLTL for both Community Health Choices and Fee-for-Service, and the Office of Developmental Programs. And this is really just a reminder that the technical specifications and addendum documents are requirements to implement EVV. So if there are required fields in these documents, they are required to be in compliance with the program. This also includes if you are sending data in Community Health Choices to HHA Exchange. All of the fields that the MCOs are communicating to you as required are required, and dummy data is not acceptable. So for example, we still are seeing a high volume of dummy data for the last 5 digits of the direct care worker social security number, and that is out of compliance. That is a required field because we must be able to identify the individual providing the service. And a name alone does not enable us to do that. We need additional information. So please ensure that if you have included any sort of fake or dummy data in any of the required fields, that you correct that as soon as possible. The next update I wanted to provide was in regards to the ODP OLTL policy bulletin. So we did release this bulletin in September, and hopefully everyone has had a chance to take a look at it. One of the sections of the bulletin outlines documentation requirements when manual edits are required to correct EVV visit data. And we really wanted to clarify what this requirement meant. And this language included on the slide was also recently included in a listserv to provide additional clarification. So when we require documentation for these manual edits, the intent of this requirement is to ensure providers are prepared to provide physical documentation or hard copy documentation of the reason for the manual correction if it is requested during an on-site audit. Providers have flexibility in how to implement this requirement so that you can integrate this into your operations as seamlessly as possible, as long as physical documentation can be provided upon request. So this statement does not dictate that providers must use paper timesheets for this documentation. However, that is an option to satisfy the requirement. In contrast, if documentation is kept electronically, such as in your EVV system that you are utilizing in the notes section or somehow otherwise documented in the EVV system, that is okay as well. But you must be able to produce hard copies of this documentation as requested during an audit. Next slide, please. And then the last reminder here is really just in regards to that January 1st, 2021 compliance date. So as Britt mentioned, that is coming very quickly, and claims will begin to be impacted. So for OLTL programs, just remember that includes both OBRA and Act 150, as well as Community Health Choices. So please make sure, even if you've already implemented EVV for Community Health Choices with the managed care organizations, please make sure you also implement EVV for OBRA and Act 150. Next slide, please. And with that, I will hand it off to Chuck for Office of Developmental Programs update.
All right, great. Thank you, Kristen. Next slide, please. Great. For this slide, we just want to have a few reminders here for ODP. Again, personal care services, as Britt discussed earlier, the broad types and specialties kind of coincide with the services. So for ODP, we have, again, companion, in-home community supports, respite in unlicensed settings, and homemaker. And for autism adult autism waiver, we have community sports and respite non-licensed setting waiver. And then if you're ACAT, we have specialized skill development, respite, non-licensed setting, homemaker, and personal care services. So again, this just coincides with the Cures Act and the product type and specialties that was on the previous slide that Britt went over. So for the claims, again, the January 1st, 2020 is a very important date. So hopefully that should be bolded and flashing at all providers. Next slide, please. All right, for vendor fiscal, we are doing very well. From the common law employer and the SSP and their relationship with PALCO and those requirements, we feel everything's going successfully. There are some things we still need to work on between PALCO and SAN data as far as getting data to the aggregator, but that relationship is being worked on, and we're moving forward. So hopefully those issues will be resolved soon. And if you are a new CLE or SSP, hopefully CLE, that there's some information here that you can go to the PALCO website and download their information, or your prospective participant directed, you want to get participant directed services through PALCO, just go to that link there and they will help you set that up. Next slide, please. All right, my section was very short, and so now I'm going to turn over the frequent issues and resolution steps to Ms. Jen Grimm from our office.
Thanks, Chuck. So basically, a lot of the slides you're going to see that I'll be going over, you've seen them if you've participated in previous these meetings previously. You'll see some repeats. So, and that's only again because we want to continue to emphasize certain components of EVV that we think you should focus on. Okay, this is a new slide you've never seen before, and what this basically covers is the frequency of visit exceptions. So you can tell by the coloration here, you know, you look at the color indicator on the side here that tells you, you know, what exceptions are setting and the volumes of those exceptions that are setting. So blue would be, I believe blue is the short visit exception. That seems to be a big hitter for the visit exceptions, as well as visits without out calls. So I believe the short visit, that should be setting erroneously because that is an error in the system at the moment. So although we do see it here, it should be corrected soon, and you should not be seeing short visits as an exception in the future. Okay, next slide, please. Okay, so for visit exceptions, the only visit exceptions that you should be seeing in the system, if you see them at all, are these 7 that are listed. If you see anything else, like the short visit exception example that I gave in the previous slide, like that should not be setting. Our system should not be designed to be setting that exception. So if there's anything other than the 7 that are listed on the slide for visit exceptions, we have a contact information at the bottom of the slide. So we're asking you to definitely report that if you're seeing anything other than what's listed. Next slide, please. Okay, so this is a repeat slide from our previous meetings. So basically the error status code, you guys should all know this at this point. If you're submitting claims and those claims have personal care services on them, they're being assessed during the claim adjudication process for EVV. So that validation is occurring against the EVV aggregator, and they're actively setting. They're setting in pay and list mode, which means your payment isn't being impacted. So our expectation from a department perspective is that, I mean, we're having these set so that you could really review why they're setting. If they're anything other than a 925, 925 means that you, ESC 925, means you have passed the validation, the EVV validation. So it's 927 or 928, those are errors that we want you to be looking at why they said, and then thinking about how to make those corrections in the future so you don't repeat the same errors, because at some point, with dates of service January 1st, 2021, as multiple people have stated, your claim will deny if you're setting those edits. So again, we do have a guide on the DHS EVV website for your reference, and we give some recommendations for resolution. We identify why the different scenarios of why the ESC would be setting, and then we have some resolution recommendations. Next slide, please. Okay, we typically show you these metrics and progress towards readiness in terms of January 1st. So we want to see very high percentages for 925. I don't know, 6% is not very high for OLTL. So you'll see the OLTL fee for service, 925, 927, 928. And the percentages of the ESCs that are setting. So the goal is to have 925 as high as possible and 927 and 928 as low as possible. So the next section is ODP's percentages and the percentages of those EVV ESC setting. We actually haven't seen too much progress between the month before September and then to October. So it's definitely below our expectations as a department, these percentages. The last section is the managed care EVV edits and their percentages. They actually are doing if you look, they're doing the best. They're actually, I think, a pretty nice size percentage in terms of setting 925. Next slide, please. Okay, this again are the verification steps that we did include in our last meeting. And I'm not going to read everything on the slide. It's pretty self-explanatory if you go through it, if you download this document and you go through it. But the bottom line is, if you see these edits setting, use the guide as your companion and, identify what the issue is, and then resubmit. The likelihood is you'll have to resubmit those EVV transactions. If you're an alternate EVV user, you would have to make those changes in your source system, make sure that the EVV record is in verified status and there are no exceptions, resubmit those transactions back to the aggregator, and then resubmit your claim. It's really important that those transactions are in the aggregator before you submit the claim transactions. So if you don't time them correctly, then you could be setting these EVV edits, because it will say that the visit is not found. Again, if you submit an EVV record to the aggregator and it is not in verified status, it's basically during the validation process, it will be considered, we'll just call it invisible. It has to be, the record has to be in verified status, meaning no exceptions exist, in order for it to be validated against during the claim adjudication process. So, and again, you cannot, in the aggregator, you cannot make changes in the aggregator. It is just a big old database that you can view your transactions in. Excuse me, but you would make those changes in your source systems, and then you would resubmit them back to the aggregator. Next slide. I think I covered a lot by babbling. So yeah, so see how on this slide we show incomplete. So if it's an incomplete status of record, if you're looking in the aggregator, you see incomplete, that's obviously not in a verified status. So that would be a record that you would need to adjust in some way or make corrections in some way, and resubmit back into the aggregator before it can be validated against. Next slide, please. Yeah, and this is kind of a repeat of what I just said, that those records need to be in verified status. And again, HHA Exchange users, I just wanted to point out that they should validate their visits in HHA Exchange. If your agency is using a combination of these, then you'll need to check all of them regularly. So you may have to look in different data sources to do reconciliations. Yeah, and again, aggregator read only. It's a big database. You don't make any changes. No one has the ability to make changes in that system. Next up, next slide, please. Yeah, this we've shown again in the past, and it shows where that visit status is located in the aggregator and in the DHS SANdata EVV solution. So I know it's not very clear, but you get the general idea where that visit status is located in the system. Next slide, please. Okay, so I'm going to pass it now to Ellie, I believe, for DHS system implementation updates.
Thank you.
You're welcome.
With the implementation, if providers have not already started implementing electronic visit verification, providers are at risk at being out of compliance on January 1st, 2021. Alternate third-party EVV systems, fee-for-service providers using an alternate EVV who have not already reached out to begin the aggregator certification process must contact SANdata Alternate EVV support team by phone at 1-855-705-2407 or by email at paaltevv@sandata.com as soon as possible to begin this process. Providers must receive their production credentials and confirm their EVV data is viewable in the aggregator portal to complete the certification process. Providers electing to use the Department of Human Services SANdata EVV system. Providers electing to use the DHS SANdata EVV system must complete SANdata's self-paced training in order to receive credentials to use the system for OBRA Act 150 and Offices of Developmental Programs, as well as the Medical Assistance Program's fee-for-service participants. Upon completing the self-paced training, providers will be issued a welcome kit, including their agency's production credentials. Providers must set up their agency and direct care workers in the EVV provider portal and train the rest of their staff on how to use the system, including the SANdata Mobile Connect application and telephonic visit verification, visit capture modalities to their direct care workers. Next slide. The DHS SANdata EVV system is only available for fee-for-service providers. Self-paced online training is available for new providers or provider administrators wanting to use the DHS SANdata EVV system. There's the registration link, and then you select Pennsylvania DHS Electronic Visit Verification Self-Paced Training for Agency Providers. Remember, this is not the training for the DHS aggregator. 604 unique provider agencies have completed training and received welcome kits to date. It is expected that fee-for-service providers planning to use the DHS SANdata EVV system are actively using the system now or will begin using the system as soon as possible. If you are a fee-for-service provider who completed training but have yet to receive a welcome kit for your agency within 5 business days of completing your training, please contact PAC at 800-248-2152 or the following email address. Please check spam junk folders for your welcome kit and/or login credential emails. While all agencies are expected to be actively using EVV now, an agency may still opt to use the DHS SANdata system. Any agency still needing to use the DHS SANdata EVV system must complete the training before December 4th, 2020 in order to receive your welcome kits and credentials prior to January 1st, 2020. DHS expects that any agency intending to use the DHS SANDATA EVV system has completed the following: LMS EVV training, received your welcome kit credentials, set up your agency administrators and DCWs or direct care workers, trained your agency employees on DHS SANDATA EVV, and are now using EVV for all of your EVV eligible care, verifying your visits against your claim data. October 30th, 2020, SANDATA's release. Client Social Security number field is grayed out. When a fee-for-service client's information is entered, the Social Security number field is now grayed out and cannot be edited. This ensures the Social Security number field cannot be edits on the client's profile. Visit maintenance, orange exceptions now display correctly. Exceptions that require acknowledgement are now indicated with an orange dot on the visit maintenance screen. This change creates consistency between the visit maintenance and visit details screens. Globally, the county field added. County field was added to the following screens: visit detail screen and SANDATA EVV and aggregator, edit client screen and SANDATA EVV billing scheduling, edit client, create client, and view add additional addresses, screens, and SANDATA EVV. SANDATA updates recent releases. A release of the newest version of the SANDATA Mobile Connect app was deployed on November 19th, 2020. The app update was submitted to both the Google Play Store and the Apple App Store on this date. Please note that based on the store's processing time, it may take up to 2 weeks for the app update to become available. DHS SANDATA EVV billing option is scheduled to be available in Q2 of 2021. Any provider using the DHS SANDATA EVV will receive notice when billing is live and functional. When billing is live, providers will be directed to take the recommended scheduling and billing training in the DHS SANDATA LMS system. I believe this next section is for Kristen.
Thank you, Ellie. So we'll provide a few additional updates for those that are using alternate EVV systems, and then we'll move into a few new FAQs we received since the last meeting. So for the alternate EVV certification process to date, we have had 212 providers in receipt of their production credentials. Of those 212, 79 have confirmed data in the DHS aggregator. That still leaves 133 providers who have received production credentials but have not completed the certification process because they still must confirm data is setting and showing appropriately in the aggregator. So please, if you are one of those 133 providers, or you think you might be, please look at the DHS aggregator to make sure your data is appearing appropriately so that you can confirm directly with SANDATA through the PA Alt EVV email that everything is okay and your data is flowing properly, or that you can work with them on any outstanding issues. This is extremely important because just because you've received production credentials doesn't mean your data is showing up properly, and we want to make sure everyone troubleshoots these issues before January 1st when claims impacts will begin. And then providers using alternate EVV systems currently with credentials but have been unresponsive, there are 57, and the department is currently conducting direct outreach through phone calls to those providers. So if you do receive a voicemail, it is because we are trying to make sure that you successfully complete the process. Next slide, please. And these next two slides are going to show the list of alternate EVV vendor systems that have completed the certification process. And this really illustrates the complexity of the Pennsylvania program and just how many different vendors we have participating. The next slide, please. So you can see in total we have 66 vendors who have completed. And if you don't see your vendor listed on here, please make sure you're working closely with your vendor to complete that process. Next slide, please. So as we noted before, the last step of the certification process is to confirm your data. So this is really just outlining the instructions mentioned earlier that if you haven't done that yet, you need to email the PA Alt EVV account as soon as possible to either verify your data is correct or to identify issues so a resolution can be worked on as soon as possible. Next slide. And then this is just a request ongoing. We do receive a lot of inquiries that don't have a whole lot of information and detail about really the issue at hand. So in order to be more efficient with how we can address and resolve issues, we are asking that providers include details about the system that they are using and really try to illustrate the issue that they're experiencing, any ticket numbers, to help move the process along so there aren't delays in correcting whatever issue you may have. Next slide, please. And with that, we'll move into a couple FAQs to wrap up. Next slide. So this FAQ, I will say, is a repeat, and then the rest will be new FAQs. And this is just, again, a plug for everything Jen had mentioned earlier about error status codes and billing. And the reason we keep repeating this is because this is really the most urgent and important activity you can be doing right now, is making sure that you will not be experiencing any sort of claims impact on January 1st. And those error status codes are the best way to do that and identify any remaining issues you may be experiencing. Next slide. And then if you are still experiencing any issues with participants who are missing or being rejected, please continue to contact the PAC Assistance Center here below. Next slide. So in the ODP OLTL bulletin, there were compliance requirements outlined for manual editing of visit data. It is expected that providers work to achieve at least 50% of EVV visit data without manual edits starting January 1st of 2020. And I want to emphasize that 50% is really a baseline. And we're doing this because we really need to ensure that the quality of the EVV data is improving over time. And we want to start with a 50% percentage rate for now, but we encourage providers to try to achieve as good and clean of quality data as you can as your staff and your office becomes more acclimated to the system. So in order to really understand where your agency is at over time, the screenshot below shows one way that you could identify that through the aggregator. So there is a visit verification summary report, and this only shows modified visits. So providers could use this report and select a date range and then look at your total visits to calculate how many of those were manual. So what would show up here would be all of the manual edits of your total visits. For those providers and community health choices, HHA Exchange has also added quite a few quality measures into their portal. So you can not only look at your agency's overall compliance rate, which is really what we're looking for. The 50% measure is for an agency, but then it's also going to break down for you rates by your direct care workers. And that can really help you identify if there are certain direct care workers who are still having more difficulty than others. So you can provide additional training and support to help your overall agency's rate improve. Next slide. So will providers receive any information about the percentage of manual corrections that are being completed if they are under 50%? So providers will need to track the percentage of manual corrections on their own, and providers with manual edits below the 50% threshold will not receive anything from DHS on a quarterly basis, but we will be monitoring the manual corrections and provide technical assistance as needed. And each of the program offices may choose to integrate this particular manual editing compliance rate into their ongoing monitoring as it's appropriate. So OLTL, ODP, and OMAP all have their regular monitoring activities that they do with providers, whether it's on an annual or a semi-annual basis. And it could be that these percentages are also integrated into those activities as well. Next slide, please. So another question we received, we have noticed claims showing up in our SAN data system from phone numbers that are not associated with our agency. For example, some providers are seeing phone numbers with area codes from Florida, Texas, California, etc. How are these able to make it into the SAN data system? So unfortunately, these are robocalls. Anyone with a cell phone, I'm sure at this point, is aware of the high volume of robocalls just on a daily basis. So robocalls to agency-specific telephony visit verification numbers, although they are infrequent, do occur nationally. When this occurs, providers will need to mark these as do not bill. Next slide, please. And with that, we'll just wrap up with the EVV context. Next slide. So as you're probably familiar with by now, these are all of the different resources we have for you. We do always include in pretty much every departmental presentation at this point, the COVID-19 resources, as well as the different email accounts, either for department-related questions, our DHS resource account, as well as the SAN data, both PAC support and alternate EVV support lines. And then you can also see the HHA Exchange system question resources here if you are in community health choices. And with that, I think we are done for the day. We appreciate everyone attending, and we do see that we have received quite a few questions in the chat, and we will consolidate all of those and release answers to all of your questions over the listserv in the coming weeks. I wish everyone a happy holiday season. Have a good afternoon.